MD and PA. It's a natural kind of combination because they're both housed in the School of Medicine, and PA is this nice group of 20 to 22. They already partner in interprofessional education, so that might be we make a case in telehealth and we implement it and to talk about like how to advise a patient on lifestyle medicine. But that's a very late skill for them. It's year 4, 5, and 6 for our learners, and then the final year of the PA students. We would need to build in, I think, a fundamental curriculum for both of them, and be very strategic about that, which it's tough to do. It's really hard. And I've lost some people to our IPE efforts just because they have other responsibilities. We've lost staff, we've lost faculty, and our big mandate is now service learning and engaging them in the community. So I did meet someone for a potential elective. I haven't asked her yet, but she just presented to our residents on Thursday, and she is shifting her career to lifestyle medicine. She's at St. Luke's. It's Sarah Miner, if any of you know her. And she just mentioned that offhand. She was doing an update for hem-onc diagnosis and chemotherapy complications. So she may be someone we could create an elective for our learners, but I still feel like she'd only be comfortable with MD students. But at least our students have a chance to see it in practice. But that's very late. I think we'd be most successful in adding or looking at this curriculum and seeing where we could add it and potentially combine learners. Again, MDPA is an easier win, but we could work very closely with other courses and see if we could add it for the School of Nursing and Health Sciences, which I think is a must do. Sorry if that's long, but we just submitted the report again, and we just said we can't do 5 poverty simulations. I'm sorry. And so I'm a little bit coming from that, is that we've asked for resources. We've been promised 2 director positions and an admin, and it just always tends to be outlying over here. So adding something to IPE right now would be very difficult because we've already taken poverty simulations away, which is very frustrating to me, but we can't keep, it's evenings, weekends. It takes 30 people to pull it off, and it's for 400 learners. And that's not a small thing. It's not a small ask, but we've been asking for a long time. And so we just can't do it anymore.
And Stephanie, I think you and I wrote a grant to help fund IPE like 4 years ago, right? And it was not accepted well, I don't think, but.
IPE is sort of the old thing that you just need to do it. I think most expect schools to support their faculty and staff. I think this new sexy thing is service learning and community engagement. And there's not a lot of evidence. I mean, for me, that is wellness. I do about 3 times more than I get funded to do because it's my why. But it would be hard to tell students to do more to volunteer when I'm sitting here saying I can't volunteer anymore time in service to UMKC. So that sounds terrible. But it's the reality is that I just keep getting, sorry. I was like, wait, we were just awarded $40 million from the state. And like, well, we have to match it. So until we match it, we can't give you anything still. And so I just it's a little disturbing because the majority of faculty, all of us, have added more. And so IPE is the thing that will go. And we've nailed it for the accreditation standards for at least 7 programs, honestly. And so I keep reminding them that your accreditation standards are at risk, but all of us curriculum folks would never let that happen. We never would. We bleed dry until we let that happen because then our learners suffer. So it's tricky. But I think we could plan some sort of curriculum that we can implement JRE lectures in clinical practice of medicine during year 3, and then just see if there's a way to combine learners, especially because we're more savvy with online education.
Yeah. And ideally, the other thing about getting this kind of earlier in the curriculum rather than later is that it would actually maybe help out the students themselves a little bit too, if they're more aware of their nutrition and health and physical fitness and those kind of things. So
definitely
make for better students,
right? And they're likely to go into practice as this professional that understands it well enough to both advise their patients on it and practice it themselves. And I think that's the real issue too for burnout and the things that all of physicians and professionals are facing, is that if we continue to make this just our calling and it's all we do is this job, and then we don't do what we ask our patients to do, we quickly become a patient. And then we don't have the time it takes to take care of ourselves. So we really do need to train all of our professionals, not just how to teach this and help their patients, but how to incorporate it into their own self-care.
But yeah, I think the big barriers right now are just finding the exact time we can get it in there. I was telling everybody earlier, Stephanie, they just put out a call, at least to Children's Mercy docs, to get on the curriculum committee at UMKC Med School.
Great.
I thought about maybe doing it, but I didn't know what exact amount of commitment that was with all our weekends that we do with sports stuff. I don't know if I'd really be able to be involved, but
as a member, it's just a meeting. It's usually the second Monday of the month, but because it's only once a month, it tends to be about a 2-hour meeting or 2.5-hour meeting. And then they'll send a few items out for approval if there's something that needs to be approved before the next meeting. If they would do twice monthly meetings, they could probably keep it down to an hour and a half, but they do a lot of important reviews of curricula and additions. And if we were to approach someone with this idea of we'd like to implement this and work with course directors on a longitudinal curriculum, that's where it would go. First, they'd approve that it meets the objectives of the overall school and mission and degree and won't put anything else at risk, like step 1 scores and step 2. And then they would work with us to implement in coursework and then clerkships kind of across the board. But being on the council, you certainly could influence and help in that way. I don't think it's a big commitment, but as I became chair and associate dean, I literally knew 5% of the job I needed to do to run the whole thing. So that's sad that I say that that's how little the commitment is, but the job is really big. That's why you have like a senior associate dean and 2 associate deans and 2 assistant deans, is they manage a lot, especially because it's a 6-year program. So they have some oversight of the bachelor's degree as well. It's very unique.
Cool. Okay. Well, I'll look into it more. I think the due date is tomorrow.
So, oh, okay. Let me know if you need a letter.
Nominating. Okay. I just finally saw it the other day. Yeah. I paid attention to it the other day.
Yeah, I think you should. It's a really wonderful council. They do a lot of great things. And there is an annual review. I should tell you that there'll be a little retreat that's 4 hours, and they'll give you a section of the curriculum, which is the time to consider adding new curricula. And it's usually around February.
Okay. Good to know. Yeah. All right. Anybody got any other questions or thoughts? Because if not, I'm totally fine giving everybody some time back with their day, because I have a couple more meetings.
Maybe one. Oh, go ahead.
Oh, sorry. The only thing I was going to say is, we're trying to work on pinning down a speaker for the healthcare group, like Shelley was mentioning earlier. We reached out to Jennifer Trilk from South Carolina, who we met with before, and asked her if she would want to do it. And she's very interested. I believe my sense is she gets this request a lot, and she has a standard fee that she requests for these types of meetings. We offered to give her some initially, and she said that her rate was much higher, about $2,500 for 2 hours. So Jennifer, if you, for those who weren't on the call, Jennifer Trilk is at the University of South Carolina, Greenville School of Medicine. They've integrated lifestyle medicine throughout their entire curriculum. They got a lot of really great things. She also has created lifestyle medicine education.com or something like that. So she's got a lot to offer the group. Likewise, $2,500 is a lot of money. We can potentially make this work if this group is really firm on having her participate, or we could try to find additional speakers that may be a little bit more in what we were expecting to pay. So just initial thoughts.
I mean, if it's going to be that big of a fee, is there a way to kind of incorporate more of the groups and the whole KCPA plan into it, so that you get. I don't know if other people would be interested in it like we would, but make it sort of a multi-group thing.
Yeah, I think that would be the concern is, would the other sectors find it as valuable as this sector would be? Just as a side note, we are targeting initially for the larger group, the head of the CDC Physical Activity, Nutrition, and Obesity branch as the keynote for the overall group, because that kind of touches on a lot of different, basically all the sectors. So that's kind of who we're targeting for that slot.
So Robin, sort of along the lines of what Jay's asking, what do you think do you think she would be willing to provide some additional, I'll say, consulting if we're able to pay that initial fee, and could that potentially guarantee a few more hours over the course of a year that we could go back to her and say, hey, this is where we are and we just, want your advice?
Yeah, so her email says, I haven't asked her directly. She said, blah, 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 considering the time for blah, 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 preparation, content areas, and PowerPoints, delivery of material, and Q&A time. My usual speaking fee is $2,500 for a 90-minute lecture with Q&A. So I would, in our initial meetings, she seemed to be open to that, but I guess we can follow up with the specific asks.
Or is that something we could invite, some bigwigs at the UMKC Med School to listen to that lecture too? So you got to see how it's been done. Other ways it's happened. I don't know. That would help.
I was thinking about that, Jay, is maybe we can make it into combine a few things.
We could actually, we're looking for a faculty development and interprofessional education. And that might have a broader reach if all of our health professional schools invite her to talk about this and ways to incorporate this in our individual curricula. And then we could be very strategic about that. We could ask all course directors to attend, offer CME and CEU, have all clerkship directors attend. And we could even choose a time when our clerkship directors normally meet. Sometimes course directors can also meet at that time. We could see if, like over the noon hour would appeal to all of your faculty, because then once you give them this sort of gold standard and model, and that she has this curriculum she offers, you can start to think about ideas. Certainly Brandon Elder is the new course director for clinical practice of medicine. I know he would be very open to starting with some of those fundamental lectures and would be part of that faculty development. And then the more broad we make it across the health science professional schools, we could ask all the deans to contribute, right? It's just 2,500 turns into like 700 each. And so I think that's fair. I have some budget for my interprofessional education. I'm checking on it today. And usually I have until at least July 1st to spend it. We could pull it from there. Probably not the whole 2,500, but I could certainly provide some for School of Medicine. And then I think you get a really nice opportunity. We were hoping to do DEI, and I just saw where they pushed it off. So we're looking for something exciting and helpful. It supports quadruple aim and joy in practice, to really start to think about lifestyle medicine and the professional development of our students. So I think it'd be worth pursuing and making it our interprofessional education faculty development. Ask all 4 health science deans to contribute, maybe offer it at a noon hour when people can attend. Okay. I'm on vacation from the next IP steering committee meeting, but I can certainly bring it up in July. I did offer to let them run it, and they said, no, we'll see you when you get back and you can run the meeting. So it's supposed to be run by a health science dean. So I'm holding on with my IP efforts, but I do think this might be a good faculty development opportunity and have a very broad reach for a lot of those involved in curricula, and then start the conversation about different ways we can each do it. I don't want us to re-silo and do it individually, but at least it will start the conversation.
Great. I think that sounds like a good plan.
Yeah.
Should I, what should I tell Jen? Should I give her just like a tentative yes?
Yes. I
Okay.
think so. And I mean, we haven't really spent much of our IPE budget anyway. And especially without holding the poverty simulations, we could shift the budget to the faculty development. I probably would pose it in actually it's an August meeting for the upcoming year. So sometime in the fall, if you all, because I think ideally we present this in October and most of our curriculum wants to get those changes in December. And retreats start to occur and things like that. So that's when people are running courses and have fresh new ideas and they're thinking about ways to change the curriculum and submit that to our council. I don't know if it's the same elsewhere. What do you all think in your positions in the world?
I mean, Stephanie, I think you're right on. All of the changes have to go through the schools before like December 1 in order to be in the next year's catalog, right? So if they don't like make it through that December 1 like deadline for our schools, then they have to go to the campus wide, blah blah blah, all that stuff. And then they don't make it into the next year's thing. And so if we don't do it before, if we don't do it and then have time for them to like chew on it, develop, incorporate changes and get it through their all of their committees by December 1, it won't happen. And there are, I don't know how medicine is, but in our school, there's like curriculum committee, which if it goes through on the one time, congratulations, right? Curriculum, faculty, steering, and then faculty assembly. So there's 3 meetings, which usually take, at least a month or so.
Mm-hmm. So I think, a tentative yes, I'll take it to the steering committee to cover it and to use budget money as well as a plan for hopefully October. I could always reach out to the health science deans anyway, since I had to cancel this meeting and say, is this something you'd consider as our faculty development? We're absolutely interested in this and feel that it would be very impactful for all of our health professional schools to consider this and that it is a good subject for interprofessional education.
Yeah, that sounds good. And so October is probably the sweet spot for the timing of that process that you guys were laying out.
Yeah.
Okay. Great. Excellent. So what we'll probably do is I think this is a great idea, and I think Jen is like the person that makes the most sense. I think we can also try to target a second individual for a lower commitment guest lecture in the August-September time frame to align with all the other sectors meeting too. So we can kind of get 2 speakers really, I think.
Yeah, and there's some like the ACSM has started doing some lifestyle medicine, like I said, that their program. So maybe there's somebody in that and kind of search through and see if there's someone in that group who would be a good lecturer too.
Yeah, and I was thinking, I haven't looked at that list, Jay, but I do know I presented a year ago at this time with the past president of ACSM from a couple years ago, Liz Joyce. She's the physician at Intermountain Health. She's now very, I don't think she's the chairman, chairwoman, but she's on the executive committee for exercises medicine. And since I was on the symposium with her last year, she might be a potential good person.
Yeah.
Okay.
Do we think it would be helpful to create sort of a panel for faculty development and have both of them? Or do you really feel that Jennifer's presentation is so complete from a curriculum standpoint, she should be sort of standalone?
It's pretty darn complete looking at it. Like it's got her own building, I think.
No, right. She's like the IPE dream, but for lifestyle medicine.
Yeah.
That's kind of my thinking as well. Great. Okay. Well, I'll move forward. Reply to Jen, and also I think, Dr. Joy would be a good person. I go to ACSM actually next week, so maybe I'll hold off on extending an invitation until I'm there, and maybe I can talk to a couple people in person and scope them out. EIM has its own, kind of track there, so that'll be good to kind of see people in person there and get a sense of who might be a good fit. So that's okay with this group.
Yeah.
Okay. Are any of the rest of you going to ACSM?
Hey, Dave, see you there.
Yeah, when are you, you're getting in next week?
Yeah, I'm only
we're all going in next week, aren't we?
Yeah, I'm just going Tuesday through Thursday.
Oh, just Tuesday and Wednesday?
Tuesday, Wednesday, I leave late Thursday. Yeah.
Okay, well, I'll see you on Wednesday.
Cool.
So,
oh, go ahead, Shelley.
Yeah, the last thing I'd like for you all to do, if you don't mind, is put a hold on your calendars on August 23rd and August 30th from 12 to 2. Those are a couple of tentative dates where we might hold the healthcare sector meeting leading up to the KCPA Plan Summit. So like Stephanie mentioned, we are trying to shoot for a noon, essentially presentation from the keynote speaker to try to get as many people as we can to actually be able to attend. However, we'll record the meeting for anyone who's not able to do it. Anyway, I know for some of you, especially anyone with a clinical schedule, you need to block it off this far in advance. That's what, as I was mentioning earlier, those are the 2 dates that Jody Dickmeyer is proposing. And so we'd like to sort of work toward that if that is okay.
Do you mind emailing those dates out?
You know what? How about if I just send a tentative hold for this group on both those 2 dates? Feel free to forward the invitation to anybody else you want to hold the dates. But for you all, I'll send that out. And then what we'll do once we confirm is send out an official meeting invitation and registration for it. Okay.
Sounds good.
Great.
All right. Well, thanks everybody for joining.
Hey, Jay, I have one thing for you if you have a minute.
Yes. Yeah, sure.
Okay. Joey and Amanda, thanks for joining. Really appreciate it.
Good to see everybody. Nice to meet you, Jay.
Thank you. Nice to meet you too.
Bye.
See ya.